Welcome back to the channel. Today we're diving deep into an organ that often gets overlooked until something goes wrong. Your gallbladder. Whether you're dealing with gallstones, planning for surgery, or just want to keep this organ healthy, this complete guide has everything you need to know. Let's get started. Your gallbladder is a small, pear-shaped organ located just beneath your liver on the right side of your abdomen. It's only about 3-4 inches long, but it plays a vital role in your digestive system. Stores bile produced by your liver. About 50 ml worth. Concentrates this bile by removing water, making it 5 to 10 times more potent. Releases bile into your small intestine when you eat fatty foods. Helps break down fats for proper digestion and nutrient absorption. Think of it as a storage tank that squeezes out digestive juice exactly when you need it. When you eat a fatty meal, your gallbladder contracts and pushes bile through a duct into your small intestine, where it emulsifies fats, breaking them into tiny droplets that your body can absorb. This is the most common problem affecting 10 to 15% of adults worldwide. What are they? Hard deposits that form in your gallbladder can be as small as a grain of sand or as large as a golf ball. Two types: cholesterol stones, 80%, yellow-green, formed from excess cholesterol pigment stones, 20%, dark brown, black, formed from excess bilirubin symptoms, sudden, intense pain in upper right abdomen, biliary colic, pain between shoulder blades or right shoulder pain that lasts 30 minutes to several hours, nausea and vomiting, indigestion, bloating and gas, especially after fatty meals, fever or chills if infection develops. Risk factors: the 4 F's, female 40, middle age, fertile, pregnancy increases risk, fat, obesity, plus, rapid weight loss, diabetes, family history, certain medications, usually caused by gallstones blocking the cystic duct, acute cholecystitis, sudden severe inflammation requiring emergency treatment, chronic cholecystitis, repeated episodes causing gallbladder wall thickening symptoms, constant pain, fever, tenderness, nausea, gallstones in the common bile duct, can cause jaundice, yellowing of skin and eyes, may lead to pancreatitis, requires immediate treatment. Gallbladder doesn't empty properly, no stones present but similar pain symptoms, diagnosed by ejection fraction test, HIDA scan. Small growths on the inner gallbladder lining, usually benign but need monitoring. Polyps over 10 mm may need removal due to cancer risk, rare but serious, often discovered accidentally during gallbladder removal. Risk factors: chronic inflammation, large polyps, porcelain gallbladder. Physical examination: Murphy's sign, pain when doctor presses under right rib cage while you breathe in, checking for jaundice, assessing tenderness and fever. Blood tests: liver function tests, ALT, AST, ALP, bilirubin, complete blood count, checking for infection. Amylase and lipase, to rule out pancreatitis. Ultrasound, first-line test, 95% accurate for detecting gallstones, non-invasive, no radiation, shows gallbladder wall thickness and inflammation. HIDA scan, hepatobiliary scan, tracks bile flow from liver through gallbladder, measures ejection fraction, normal is 35% or higher, best for diagnosing biliary dyskinesia. CT scan, used for complications, better for acute cholecystitis assessment. MRCP, MRI of bile ducts, excellent for bile duct stones. Non-invasive alternative to ERCP. ERCP, endoscopic retrograde cholangiopancreatography, both diagnostic and therapeutic. Can remove bile duct stones, has some risks. For gallstones, ursodeoxycholic acid, ursodiol, Actigol, urso, dissolves cholesterol stones slowly over 6 months to 2 years, only works for small cholesterol-based stones, 30–50% success rate, stones often return after stopping medication, typical dose, 8–10 mg per day. Important, most doctors recommend surgery over medication because limited effectiveness, long treatment time, high recurrence rate, only works for specific stone types. NSAIDs, ketorolac, diclofenac for acute pain, reduce inflammation. Antispasmodics, hyoscine butyl bromide, buscopan, relieves gallbladder muscle spasms. Opioids, used for severe pain. Meperidine preferred, less sphincter spasm than morphine. For infection inflammation. Antibiotics, ceftriaxone, metronidazole, used in acute cholecystitis. Shockwave, lithotripsy, sound waves break up stones. Rarely used anymore. Limited success, stones recur. Contact dissolution. Therapy, direct injection of solvents into gallbladder experimental, rarely used. Surgery is recommended for symptomatic gallstones, recurring pain, acute cholecystitis, gallbladder polyps over 10 mm, porcelain gallbladder bile, duct stones with gallbladder stones. The procedure, 4 small incisions, 0.5 mm each. Carbon dioxide inflates abdomen for better view. Camera inserted to visualize gallbladder. Specialized instruments remove gallbladder. Duration, 45 minutes to 2 hours. Usually done under general anesthesia. Benefits, minimal scarring, less post-operative pain, shorter hospital stay, same day or overnight, faster recovery, 1-2 weeks, lower infection risk, success rate, over 95% recovery. Timeline, day 1-2, rest, manage pain, light walking. Week 1, gradually increase activity, avoid heavy lifting. Week 2 to 3, return to work, desk jobs. Week 4 to 6, resume all normal activities, exercise when it's needed, severe inflammation or scarring, unclear anatomy during laparoscopy, complications during laparoscopic attempt, suspected gallbladder cancer. The procedure, 5 to 7 inch incision under right rib cage, direct visualization and removal. Duration, 1 to 2 hours. Recovery, hospital stay, 2 to 5 days. Full recovery, 4 to 6 weeks. More pain initially. Larger scar. Possible complications, rare. Bile duct injury, 0.5%. Bleeding infection, blood clots, bile leakage, injury to nearby organs. What happens during surgery? Cystic duct and artery are identified and clipped. Gallbladder is carefully dissected from liver removed through one of the incisions. Area is checked for bleeding. Incisions are closed with dissolvable stitches. Here's the good news, you can live a completely normal, healthy life without your gallbladder. What changes? Bile flows directly from liver to small intestine continuously. No storage mechanism, but your body adapts. Most people have no long-term issues. 1. Loose stools or diarrhea. Effects. 10-20% of people. Usually improves within weeks to months, caused by continuous bile flow into intestines. Management. Eat smaller, more frequent meals. Gradually increase fiber intake. Reduce fat intake initially. Stay hydrated too. Post-cholecystectomy syndrome. Affects about 5 to 10% of people. Symptoms. Abdominal pain, indigestion, bloating and gas, nausea. Causes. Bile duct stones remaining. Sphincter of Oddi dysfunction, irritable bowel syndrome. Other digestive issues unrelated to gallbladder. When to call your doctor. Severe or worsening pain. High fever, yellowing of skin or eyes. Persistent nausea, vomiting. Signs of infection at incision sites. Long-term outlook. 90% of people feel much better after surgery. Quality of life significantly improves. Can eat normally once recovered. No restrictions on activities. Foods to embrace, high fiber. Foods, whole grains, oats, brown rice, quinoa, whole wheat bread. Fruits, apples, pears, berries, oranges, prunes, vegetables, broccoli, Brussels sprouts, carrots, leafy greens, legumes, beans, lentils, chickpeas. Target, 25 to 35 grams of fiber. Daily, healthy fats, moderate amounts. Olive oil, 1-2 tablespoons per day. Avocado, 1-4 to 1-2 per day. Fatty fish, salmon, mackerel, sardines, 2-3 times per week. Nuts and seeds, small handful, omega-3s. These help gallbladder contract regularly. Lean proteins, skinless chicken breast, turkey fish and seafood, egg whites or whole eggs. Moderate. Tofu and tempeh. Greek yogurt, low fat, vitamin C, rich foods. Citrus fruits, bell peppers, strawberries, kiwi, tomatoes may reduce gallstone formation. Foods high in magnesium, leafy greens, nuts and seeds, whole grains, dark chocolate, small amounts, coffee. Studies show 2 to 3 cups daily may reduce gallstone risk, stimulates gallbladder contraction. High-fat foods, fried foods, French fries, fried chicken, donuts, full-fat dairy, whole milk, cream, butter, cheese, fatty cuts of meat, ribeye, pork belly, bacon, processed meats, sausages, hot dogs, salami, creamy sauces and gravies, pastries and baked goods with lots of butter, refined carbohydrates, white bread and pasta, white rice, sugary cereals, pastries and cakes, candy and sweets, trans fats, margarine, commercially baked goods, packaged snacks, fast food, very low-calorie diets. Crash diets increase gallstone risk. Rapid weight loss is dangerous. Lose 1 to 2 pounds per week, maximum. Pro tips: eat regular meals. Don't skip breakfast. Don't fast for long periods. Stay hydrated. 88 to 10. Bong son dabo Christians. Self-Christians, non-jerdula. Ein son zustanzova. Bouts of water daily. Eat smaller, more frequent meals. Cook with steaming, baking, or grilling instead of frying. First few days. Post-surgery. Clear liquids. Water. Clear broths. Apple juice. Herbal tea. Gelatin gradually progress to toast crackers, rice bananas, applesauce. First 2-4 weeks. Focus on low-fat, easy-to-digest foods. Breakfast ideas: oatmeal with banana, low-fat yogurt with berries, scrambled egg whites with whole wheat toast, smoothie with fruits and low-fat milk. Lunch ideas: grilled chicken with steamed vegetables, turkey sandwich on whole wheat with lettuce, vegetable soup with crackers, baked fish with quinoa. Dinner ideas: lean protein, 4 Oz, with sweet potato pasta with tomato sauce and vegetables, stir-fried vegetables with tofu and brown rice, chicken breast with steamed broccoli snacks, fresh fruits, raw vegetables with hummus, low-fat cheese sticks, whole grain crackers, air-popped popcorn. Most people can gradually return to normal eating, but consider: keep fat intake moderate, 30-40 grams of fat per day initially, gradually increase as tolerated. Choose healthy fats over saturated fats. Increase fiber. Gradually, helps regulate bowel movements, prevents constipation or diarrhea. Aim for 25-35 grams daily. Foods that may cause issues: spicy foods, caffeine. Start small. Dairy products. Some people develop temporary lactose sensitivity. Raw vegetables may cause gas. Beans and legumes. Start with small amounts. Helpful strategies: keep a food diary. Eat slowly and chew thoroughly. Don't lie down right after eating. Stay hydrated. Take probiotics if recommended by doctor. 1. Maintain healthy weight. Obesity increases gallstone risk by 2 to 3 times. BMI of 25 to 30. Moderate risk BMI over 30. High risk lose weight gradually, 1 to 2 pounds per week. Avoid yo-yo dieting. 2. Exercise regularly. 30 minutes of moderate activity, 5 days per week. Walking, swimming, cycling, dancing. Reduces gallstone risk by 20-30%. Helps maintain healthy weight, improves digestion, reduces inflammation. 3. Eat regular, balanced meals. Don't skip meals, especially breakfast. Eating stimulates gallbladder contraction, prevents bile from becoming too concentrated. Include healthy fats to keep gallbladder working. 4. Stay hydrated. Drink 8 to 10 glasses of water daily. Helps thin bile, prevents stone formation, aids digestion. 5. Limit alcohol, moderate consumption. Only excessive alcohol can cause problems, but some studies show moderate intake may be protective. 6. Don't smoke. Smoking increases gallstone risk, affects bile composition, slows gallbladder emptying. 7. Manage chronic conditions. Control diabetes. Uncontrolled diabetes increases risk, lower high cholesterol and triglycerides. Treat liver disease. Manage Crohn's disease or other GI conditions. 8. Be cautious with medications. Some medications increase gallstone risk: hormone therapy, birth control pills, cholesterol-lowering drugs, rapid weight loss medications. Discuss alternatives with your doctor if concerned. 9. Consider your family history. If family members had gallstones, you're at higher risk. Be more vigilant about prevention. Regular checkups. 10. Pregnancy considerations. Pregnancy increases gallstone risk. High estrogen levels affect bile. Eat healthy during and after pregnancy. Don't gain excessive weight. Call 911 or go to ER if you experience severe persistent abdominal pain lasting more than 5 hours, high fever, over 138.3 with abdominal pain, yellowing of skin or whites of eyes, jaundice, pale, clay-colored stools, dark urine, tea-colored, confusion or altered mental state, rapid heartbeat with pain, severe nausea and vomiting, preventing fluid intake. See your doctor soon if you have recurring pain in upper right abdomen, pain after eating fatty foods, persistent indigestion or bloating, unexplained weight loss, loss of appetite, persistent nausea, itchy skin may indicate bile buildup, post-surgery warning signs, increasing pain instead of improving, redness, swelling or pus at incision sites, fever over 100.4 degrees Celsius, persistent vomiting, inability to eat or drink, worsening jaundice, severe abdominal swelling, regular checkups, if you have risk factors, annual physical examination, liver function tests, ultrasound if symptoms develop. Discuss prevention strategies with doctor. Myth number 1, you need your gallbladder to digest food. Fact, your liver produces bile. The gallbladder only stores it. You can digest food perfectly well without a gallbladder. Myth number 2, gallbladder surgery is dangerous. Fact, laparoscopic cholecystectomy is one of the safest, most common surgeries performed. Complications are rare. Myth number 3, you can't eat fatty foods ever again after surgery. Fact, most people can gradually return to normal eating, including moderate amounts of fat. Myth number 4, gallstones always cause symptoms. Fact, 80% of people with gallstones have no symptoms. These are called silent stones. Myth number 5, cleanses and flushes can dissolve gallstones. Fact, no scientific evidence supports gallbladder cleanses. They may actually be dangerous. Myth number 6, only overweight people get gallstones. Fact, while obesity is a risk factor, thin people can also develop gallstones. Myth number 7, you should always remove your gallbladder if you have stones. Fact, if stones are silent, no symptoms, doctors usually recommend watchful waiting. Myth number 8, gallbladder problems only affect older people. Fact, while more common in middle age, gallstones can occur at any age, including children. Breakfast, 7 a.m., 1 cup cooked oatmeal with cinnamon, 1 cup mixed berries, 1 tablespoon ground flaxseed green tea or coffee. Mid-morning snack, 10 a.m., 1 apple with 1 tablespoon almond butter, water. Lunch, 1 p.m., grilled chicken salad, 4 oz grilled chicken breast, mixed greens, tomatoes, cucumbers, bell peppers, 2 tablespoons olive oil vinaigrette, 1 cup quinoa, water with lemon. Afternoon snack, 4 p.m., carrot and celery sticks, 2 tablespoons hummus, handful of almonds, 10-12. Dinner, 7 p.m. 5 oz baked salmon with herbs, 1 cup steamed broccoli, 1 medium sweet potato side salad with light dressing. Evening snack, optional. 9 p.m. 1 cup low-fat Greek yogurt, 1 teaspoon honey. Daily totals, calories, 1,800, fat, 50 gram, healthy fats, fiber, 35 gram, protein, 190 grams, post-surgery meal plan, first month. Breakfast, plain oatmeal with banana herbal tea. Snack, saltine crackers, applesauce. Lunch, baked chicken breast, 3 oz, steamed carrots and green beans. White rice. Snack, low-fat yogurt, peeled pear. Dinner, baked white fish, mashed potatoes, made with low-fat milk, cooked zucchini. Tips, start with 5 to 6 small meals. Keep portions small. Avoid heavy greasy foods. Gradually add foods back. Always consult your doctor before taking supplements. May help prevent gallstones. 1. Vitamin C, 500-1,000 mg daily, may reduce gallstone formation. Food sources preferred. 2. Lecithin, may help keep cholesterol and bile soluble, found in egg yolks, soybeans, supplement form available. Try. 3. Omega-3, fatty acids, fish oil supplements or fatty fish, anti-inflammatory properties, 1-2 grams daily. 4. Artichoke extract, may stimulate bile flow, traditional remedy, limited scientific evidence. 5. Turmeric, curcumin, may improve gallbladder function, anti-inflammatory, 500 mg daily with black pepper, for absorption. 6. Milk, thistle, supports liver health, may improve bile quality, 150-300 ml daily. Not recommended. Gallbladder, cleanses, or flushes, not scientifically proven, may be dangerous, can cause pain and complications. Do not attempt without medical supervision. Remember, supplements cannot replace medical treatment for gallstones or gallbladder disease. Q1. How long does gallbladder surgery take? A. Laparoscopic surgery typically takes 45 minutes to 2 hours. Q2. Will I gain weight after gallbladder removal? A. Not necessarily. Any weight changes are usually due to diet changes, not the surgery itself. Q3. Can gallstones come back after removal? A. No. Once your gallbladder is removed, you cannot form gallstones there. However, stones can rarely form in bile ducts. Q4. Is gallbladder surgery covered by insurance? A. Usually yes, if medically necessary. Check with your insurance provider. Q5. Can I drink alcohol after gallbladder removal? A. In moderation, yes, but wait until fully recovered. Some people find alcohol harder to tolerate. Q6. Will I need to take enzymes or supplements forever? A. Usually not. Your body adapts. Some people benefit from digestive enzymes initially. Q7. Can pregnancy cause gallstones? A. Yes. Hormones during pregnancy increase gallstone risk. Most resolve after delivery. Q8. Are there alternatives to surgery? A. For most symptomatic gallstones, surgery is the best option. Medication has limited success. Q9. How soon can I drive after surgery? A. Usually within a week, once off pain medications and feeling comfortable. Q10. Can stress cause gallbladder problems? A. Stress doesn't directly cause gallstones, but can worsen symptoms and affect digestion. And there you have it, your complete guide to gallbladder health. We've covered everything from understanding how this small but mighty organ works, to recognizing disease symptoms, exploring treatment options, navigating surgery, and maintaining optimal digestive health through diet and lifestyle. Key takeaways. Your gallbladder stores and concentrates bile to help digest fats. Gallstones are common, but manageable. Surgery is safe and most people recover quickly. You can live a normal, healthy life without your gallbladder. Prevention through diet and lifestyle is possible. Listen to your body and seek medical care for warning signs. If you're experiencing symptoms, don't ignore them. Talk to your healthcare provider. Early intervention can prevent complications and improve your quality of life. If you found this video helpful and informative, please subscribe to Medical Education to its Truth Reality channel for more evidence-based health content. Hit that notification bell so you never miss our uploads where we break down complex medical topics into easy-to-understand information. Your health journey deserves accurate, reliable information. Drop a comment below with your questions or experiences. I love hearing from you. Share this video with anyone who might benefit from learning about gallbladder health. Stay healthy, stay informed, and remember, your health is your wealth. Please subscribe to Medical Education to its Truth Reality channel. Until next time, take care.